It's been a rough day for the Jamaican media fraternity, having woken up to the news of the passing of broadcaster and senior journalist Michael Sharpe. He had been hospitalized for several weeks. His family, to whom we extend heartfelt condolences, has kindly consented for the Health Ministry to provide some details on the circumstances that resulted in his hospitalization. And so we're now joined by Chief Medical Officer Dr. Jacqueline Bisesa McKenzie. CMO, can you indicate the date of Mr. Sharpe's hospitalization?
Yes, so Mr. Sharpe, my understanding is that he was hospitalized on the 24th of March.
Right. And at the time of his hospitalization, was he presenting any symptoms?
Yes, he was. The report that I got earlier today, and I must say that it's not a final or complete report, but just trying to get as much information as I could at this time. So he did present with symptoms, and he was admitted to the hospital. My understanding is that a few days he would have received the COVID vaccine on the 14th of March. And shortly after, he developed some symptoms, which got worse. And he visited his doctor, had a test done. And then with the worsening of his symptoms, he was admitted to hospital. So, yes, please go ahead.
No, you go ahead.
Right. So, of course, there has been a lot of concern in the public space as to whether or not the vaccine would have caused his death. And, this is what we really want to talk about, because of late, yes, we have been, a lot of persons have been asking about deaths and the COVID vaccine. And so from the Ministry of Health and Wellness, we want to clarify some areas, because you are going to have two types of deaths that can occur after somebody could have had the COVID vaccine. And these are not related to the vaccine itself, because the vaccine does not have any virus in it, so it will not cause COVID. That's one. And the likelihood of any kind of severe reactions to the virus, to the vaccine, is very small. It's really a very low risk of getting any kind of severe complications. As a matter of fact, when the studies were completed for AstraZeneca, it was considered to be one of the safer vaccines, because there was very, very few reports of really just mild reactions and no severe outcomes. We know that since that, we would have seen the reports of the very rare occurrence of blood clots that have been reported both in the UK and in the US. So we know that that is being investigated, and there is a plausible cause that is associated between the vaccine, but that is just extremely rare incidents, that this would have happened. But in particular for the exposure to COVID, I mean, many persons, we're in community transmission right now. And so there are a lot of persons around us who are COVID positive. And so therefore, our risk of exposure to COVID before we get the vaccine, or even in the period after getting the vaccine, is still there. It's still there. And remember that we do not achieve that robust, long-lasting immunity until we have received 2 doses of the AstraZeneca vaccine and about 2 weeks have passed. So that's when we get that robust immunity. However, even after the first vaccine, there is some immunity, but that also takes time to develop. And so in that immediate period after the first vaccine, persons are vulnerable and they are at risk for severe illness if their comorbid conditions, their age and the presence of, the diabetes, hypertension, heart disease, all of those that we would have mentioned before, if they have those, then they are still at risk for severe illness. So persons have to recognize that.
I was just coming to that point because Michael Sharpe on March 14, when he had received his vaccine, had declared on tape that he was indeed a heart patient. So would that, or maybe I should ask, how much would that have made him vulnerable to severe reactions from COVID itself?
Well, we know that in terms of persons who are COVID positive, that the incidence of poor outcomes are more, one, associated with age, and secondly, with comorbidities. And we know that cardiovascular disease and diabetes put you at high risk for severe disease. So, and this is why it is important for persons, who have these illnesses to become vaccinated, because when they are exposed and become infected, they are at risk for severe disease.
Has there been at this point a cause of death?
Well, as I said, it is new, and I would not have seen the death certificate. And I know that there would have to be the examination of the medical records. And so we would await that to give a final cause of death.
An important point to reiterate in respect of the history and the timeline, though, has to do with the fact that his vaccination would have been on March 14, and his admission, I beg your pardon, would have been on the 24th. So can you say what was his condition at the point at which he was being vaccinated?
Well, at the point of being vaccinated, he would not have expressed that he had any symptoms, because that's one of the questions that we ask. Are you having any symptoms? I want to hasten, though, Damien, to say that there has been no association really found with persons who, even if they are positive at the time of getting the vaccine, that there is no increased poor outcomes associated with them getting the vaccine. And that is why there is not a requirement for pre-testing before you get the vaccine. However, we do not give the vaccine to persons who are having symptoms or persons who would know that they are COVID positive. We would ask them to wait 14 days to allow for their isolation period, for their symptoms to be all clear before we give them the vaccine. But at the same time, just to say that there has been no increased severity that is associated with somebody who has been found to be positive, as a result of getting the vaccine.
And from here on in, what happens in the process?
Well, in terms of the process for this case, certainly we would wait for the information, and the death would be classified. I just want at this time, Damien, and I should have said it before, really just to express my own sympathies and sympathies on behalf of the Ministry of Health and Wellness to the members of the family, and also to the members of the media fraternity, who I know have suffered a great loss, and really and truly to the people of Jamaica. I mean, myself, I would have seen Michael Sharpe on TV from he was on the news, and then I would have heard him on radio. He would have stepped in on hotline sometimes and stuff. So as a Jamaican people, we really would be suffering a great loss. And I just want to say that I want to express my sympathies there. But in terms of our classification of the death, then that would come later as we get all the information. So that really would be our process. Sometimes the processes seem cut and dry when there is just a huge loss and gap that is there, and you don't want to demean that, or to make it seem any small or anything like that. But the process really is that once we get the information, we would classify the death, and then we'd be able to say if we consider it to be a COVID-related death, or whether he had developed significant problems after COVID that would have caused his death, or what. I can't say what it was going to turn out to be once we get that information. However, Damien, I just want to add something, though. Our medical staff or nursing staff do come under a lot of pressure. And we have been really trying to do the best for the population over the last year in the entire management of the pandemic and in the delivering of the vaccinations. It really and truly, is very, very disheartening to hear that the nurse who administered the vaccine has been getting threats and has been really been abused verbally and is suffering emotionally because of the kind of result that persons would have taken it upon themselves to call her, to WhatsApp her. And it's very frightening for us in the medical field. We have to deal with a lot of things. And many times there are poor outcomes of patients that would have passed through our hands. But I want to assure the Jamaican population that we always try to do our best. And yes, it is that we do have poor outcomes. And we all, even us as the doctors and the nurses and all the healthcare providers suffer from those losses because we ourselves bond with our patients. And it is a great loss to us when somebody who has passed through our hands die. And to see this kind of attack on the fraternity, you know, it really affects our nurses in particular, especially our public health nurses who have been really out there at the forefront of this immunization campaign. And I really would want to appeal to the public to be measured, to carefully consider this is not as a result of the vaccine. It's as unfortunate that persons will develop COVID still and will develop severe COVID. And even I had said that there were two types of deaths because you also have deaths that have nothing at all to do with COVID that can occur after vaccination. So persons will die from strokes, heart attacks, anything else that in their natural history of their disease or disorder that can result in poor outcomes. We have no evidence to say that any of these deaths are caused by the vaccine, and certainly the persons that give the vaccines should not be treated in this way. We are all trying to do our best to get us across this hurdle, this huge hurdle that everybody has to face.
Very well. Thank you so very much. And of course, that's not something that should be condoned at any point at all. Dr. Jacqueline Bisesa McKenzie is the Chief Medical Officer updating us on Michael Sharpe, our colleague journalist who has died at the age of 65 after being hospitalized for a couple of weeks. I'm Damian Mitchell. Thanks for watching.